We have today speaking to us Mark Greenwood. He's the current UMA medical director. President, UMA president. I knew that, but here it's written medical director. I apologize. Well, not thinking, just reading. He grew up in the small rural Utah town of Richfield as the son of a country doctor. His goal was always to become a family physician and join his father in practice. Following college at Brigham Young University, medical school at George Washington University, and residency at the University of Utah, that dream became a reality. In 2018, he was named medical director for the Family Medicine Service Line in the Intermountain Medical Group, with accountability of 50 family medicine clinics, 200 family medicine physicians, and 70 family medicine APPs. He sees patients currently at Intermountain Alta View Family Medicine. So without further ado, here we go. Mark Greenwood.
Thank you. So, hi, Mark Greenwood. I'm the current president of the Utah Medical Association. Glad to be here with you. I am not familiar with the Weber State campus, and so it was a little dicey getting here. The way I found it was I just followed the people that were walking that way with their name tags on, and it became clear to me that they knew who their next speaker was. The smart ones, I think, have already left. Kudos to those of you who stuck around on a beautiful Friday afternoon, and if you haven't been outside, it's just beautiful, warm, sunny, and gorgeous out there. Looks like we're going to have a great weekend. And I'll do my best to add a little bit of value, hopefully, here and tell you about some things that are going on in medicine right now, in organized medicine, the UMA. Just so you know, I'm not a real stick-to-the-script sort of guy. There is a slide deck that was submitted that you're welcome to take a look at if you would like. Full disclosure, I am not going to stick to that slide deck or click through the slides in the slightest, but it's there for your reference if you would like to take a look at it. Maybe just a little bit about me. As mentioned, I'm a family medicine physician and grew up and practiced in a small town in Richfield, Utah. My dad moved to Richfield in 1972. I was one as a GP following his one-year internship at LDS Hospital. I was the lawn boy at our clinic growing up. I'm guessing not many of you can say you mowed the lawn growing up at the clinic where you ended up practicing. If so, we'll arm wrestle over those rights. A lot of changes have certainly happened in medicine over this intervening basically 50 years, and we'll talk about some of those. I did not necessarily understand what the topic of the conference is, and I very much enjoyed hearing that discussion on lifestyle medicine. Maybe just to, again, go off script a little bit and share a personal story. I think we've all been through the rigors of practice and the difficulties in taking care of ourselves, and that was no different for me. I found in my 30s, I'd gained a little bit of weight, was kind of out of shape, my cholesterol was going up, and I was taking a statin. I was having some acid reflux. I started to have to take Prilosec every day. And I, of course, blamed these on various things like my genetics and not having time. On May 7th of the year 2011, I joined Weight Watchers and decided I needed to take better care of myself. And I topped out at 207 pounds and having all of these, and I was snoring and probably developing sleep apnea. And I had to confess I was not taking good care of myself. Through Weight Watchers, I learned how to eat less, eat better, and exercise more, and lost about 55 pounds over the subsequent 6 months. 50 of those I've still been able to keep off, and today I weigh about 160 pounds. What I didn't anticipate was the change that it made in my health. My cholesterol went down and I got off my statin. Turns out it had nothing to do with my genetics. My acid reflux went away. I haven't taken a Prilosec in 12 years, and my snoring went away. Also, I felt better. I had more energy. My skiing was easier and better. Things that I was starting to wonder, am I even going to be able to do anymore? All of a sudden, I could do and enjoy. and it revolutionized also the way I viewed and practiced medicine, as now so many of the illnesses, conditions, and symptoms I was treating, again, from fatigue to arthritis and back pain and insomnia, all of a sudden started to be viewed now as primarily lifestyle diagnoses and conditions and not the actual thing that I was treating. And if I could get my patients to engage in lifestyle treatments and interventions, so many of their conditions could either improve or even go away. And their medications lists could be trimmed, and it completely revolutionized the way I approach practicing medicine. The thing that I felt was a little bit sad is I had to discover that through my own school of hard knocks, as opposed to that being anything that I was taught in medical school or frankly even residency. I think that we are taught sick care and not well care, and we're taught chronic disease management as opposed to upstream wellness and prevention. So kudos to the organizers of this society and the members of this society and the leaders and this topic to be able to promote lifestyle medicine. Now I just feel a little badly that I wasn't here for all 3 days. A little bit about the Utah Medical Association. We are the professional trade association for doctors of allopathic and osteopathic medicine in the state of Utah. To belong to the UMA, you need to be an MD or a DO. I recognize that there are likely nurse practitioners and PAs that are here today, and I believe that my remarks will be applicable to everyone. Admittedly, those specialties also have their own trade societies that look after their interests, but to a certain degree, we're all practicing medicine here in kind of in the same environment. We're all in the same boat and dealing with many of the same issues. So, with that, I'm going to bet that I'm the only speaker you've had that's brought with them a magic wand. This is Hermione, by the way, for those of you who are really astute Harry Potter aficionados. I've often thought, as both a doctor and now the UMA president, wouldn't it be nice if I just had a magic wand and we could just easily get things done by waving our wand and casting a spell and accomplishing some of the changes that we would like to see. So, I want to mention a few of the things that I might do if I had a magic wand. And once you really start thinking outside the box, the possibilities really are endless, but I'll mention just a few. One of which, wouldn't it be nice if our patients would follow our advice and exercise and lose weight? And we could just magically wave our wand and make our patients compliant. Wouldn't it be nice if we didn't have non-compete clauses from our employers that force us to stay with an organization or employer even if we're unhappy? Wave that wand. And here's my advice to employers. Instead of a non-compete clause, why don't you treat your physicians and your providers well so they want to stay and you don't have to shackle them and get them to stay? Wouldn't it be nice if we were compensated fairly by those same employers? And wouldn't it be nice if we didn't have stark laws to tell us how much we can get compensated? The ultimate irony being, right, Stark talks about fair market value. In reality, it is the antithesis of fair market value, right? It is price fixing, and the goal is to suppress wages and fair wages for doctors and medical providers. How about electronic medical records? Any wands we could wave there, maybe that are user-friendly and that work and that you could figure out, or maybe even just wave the wand and make those darn EMRs go away altogether. When I joined my dad in practice in 2003, we still had paper charts, and some of those charts went back to the 70s. Anybody here was practicing in the 70s? Okay. Well, you remember how that was. I got to go back to some of those charts, and literally each visit was one line. They'd write one line, and then at the end, the notation, $5. So the office visit was $5, not the copay, the visit. And an entire decade on some of those patients was one piece of paper. Contrast that to the documentation nightmare we've got going on. How about payment reform? Better yet, maybe let's just get rid of third-party payers and insurance companies altogether, including government payers. Wouldn't that be nice if we didn't have to deal with them? Maybe get rid of some prior authorizations and wave that wand. Here's one couple that I think a lot about too. Maintenance of certification. Think of the burden that places on physicians in terms of the time and the money that's spent for maintenance of certification, with no evidence whatsoever to support the practice or that it makes you a better physician or that your patients get better care for participating in those activities. And maybe the one I struggle the most with right now, I would love to wave my wand and make medical school tuition affordable. Somebody who raised their hand and said they were practicing in the 70s would be willing to share what their tuition was when they went to medical school. $500 per semester. So $1,000, $1,000 to $1,500 a year. And what school was that? I'm a fellow George Washington alumnus. Nice to meet a fellow colonial, although they're not calling themselves colonials anymore because apparently that's offensive. Go figure. I went to GW 96 to 2000. At that time, our tuition started at $32,000 and ended at $38,000, and I came out in 2000 with $230,000 of student loan debt. Thank heavens I've finally gotten that all paid off. At the University of Utah today, the tuition is $35,000 a year. So it is now more at our in-state public school than it was for me at our private school 25 plus years ago, and those students are coming out with $300,000 and $400,000 of student loan debt. I believe that is a millstone on our future generations, a millstone around their neck. I think that is a threat to the future of our profession for people to be able to go into medicine and then successfully come out of that training environment with all that debt. That is one of the big dissatisfiers and contributors to the dissatisfaction and burnout. I think it's unconscionable. A recent article in the Deseret News said the University of Utah has just been successful in raising $3 billion for their trust fund, for their endowment. I think it's unconscionable that the U has those kind of resources and is still charging $35,000 a year and going up for our future doctors. I don't know if Representative Barlow is still here. He was just before. I was just talking to him, but I would certainly encourage legislators and policymakers everywhere to figure out ways to make a medical education affordable. If I could wave this wand and make it happen, I would. Alas, I don't have a real wand, and we do not live in fantasy land, right? We live in the real world, and nothing is easy, and so we have difficult things that we have to deal with in our reality. So in the time I've got left, I'd like to maybe just talk about two main things. One is kind of the Utah Medical Association and how we work and what some of our priorities are. And then maybe two is some of the legislative issues, which is technically what they asked me to talk about. But I kind of figure once I'm up here, I can talk about whatever I want. So first of all, kind of what's going on at the UMA. So Utah Medical Association has an annual meeting every September where representative delegates from across the state and across our membership come, and they meet and they debate different topics and set the policies and the strategies for the UMA, and then the UMA board and the CEO, it's their job to execute those strategies. Any member of the Utah Medical Association can bring what's called a resolution to the House of Delegates and help set our policy. And so if you are a UMA member here, thank you. And if you're not, would invite you to join and help support organized medicine that's still working on your behalf. If you're a UMA member and you've never attended our House of Delegates, I would certainly invite you to become a delegate and come and join us. Talk to your county or your specialty society, and I'm sure they can help you become a delegate. We would love to have you participate with us. So share with you some of the resolutions that were passed at our last House of Delegates. Now, realizing this is the membership giving the organization direction on how to handle things. Some of it can be proactive, some of it can be reactive. It really is just up to the membership to bring those resolutions and set that course. And then it's up to us, depending on what also is going on in the world around us, to implement. So see if any of these things potentially speak to you. Here's one of our resolutions: that the UMA oppose attempts to impose criminal or civil penalties or otherwise impede free and open interstate travel for the express purpose of receiving health care services. We have become concerned about the notion of prosecuting physicians for delivering and providers for delivering health care. Now, this is primarily, I think, fueled by the recent abortion discussion, and I'll talk about that more, but part of that legislation, right, included criminal penalties to physicians for potentially delivering health care. Regardless of which side of the abortion debate you're on, we wanted to set policy that says we should not be going after physicians and providers criminally for delivering health care. And we want to make sure that if we go outside the state and work and deliver or receive services, us or our patients, that we cannot be prosecuted here in the state of Utah as well. The UMA should oppose the civil penalties or retaliatory efforts against patients, advocates, or healthcare providers for providing comprehensive reproductive health services. That UMA investigate avenues to discourage aggressive and erroneous retractions of insurance payments. Has anybody ever delivered care and then a year later the insurance company comes and takes the money back for the care that you provided after they only paid you 65 cents on the dollar for providing that care in the first place? Or even 2 or 3 years later? We've heard a lot from our membership about that. And that also that the UMA can limit the interval of time after a date of service during which a retraction can take place. Some of them can even be what would seem kind of simple. One was about mosquito abatement. Different things are important to different folks. I'm trying to highlight some of these. The UMA, in partnership with legislative representation and the Department of Health, worked to pass legislation and garner financial support to implement, maintain, and expand a voluntary statewide program for evidence-based newborn nurse home visiting services to all families with newborns residing in this state to support healthy child development, strengthen families. This one was actually passed. So this became law. It was funded with $15 million to support home nursing services to newborn babies in the state of Utah. Another resolution, patient access to any qualified physician, that insurance companies not be able to randomly exclude providers other than on the basis of being qualified. That's different than any willing provider. This is any qualified provider. And maybe this last one that I'd like to talk about, which I think is a transition into maybe some of the legislative things that are going on. Collective negotiation by physicians. Resolved that it be UMA policy to support the right of employed physicians, physician groups, and independent physicians to engage in collective negotiating. You're probably like me, you've heard for years that physicians cannot band together, unionize, or collectively bargain. That is not necessarily true. UMA's looked into this extensively, and employed physicians absolutely have the same rights and protections to be able to collectively bargain with their employers. UMA is trying to socialize that and would like to encourage you all to do that. The other day, driving home in the car, I heard that airline pilots were out picketing, right? They were picketing for more money. This was United. They didn't feel like they were being fairly compensated for their services and had other concerns about their conditions at work. And as a part of that story, they said United pilots are empowered by the fact that Delta pilots were just able, through their union and their negotiations, to obtain a 35% pay increase over the next 4 years. How many of you all have got to deal with your employers for a 35% pay increase over the next 5 years, 4 years? Anybody seeing that? We tend to see what, 1%, 2%, maybe if we're lucky. Well, part of that, of course, is the finances of medicine are challenging. But part of it is because the payers and the employers, they know how to collectively bargain against us, and we are on our own in negotiation with them. In fact, there is no negotiation, right? The last time your compensation was set, who was negotiating for you or representing you? And I think you'll admit that the answer was nobody. Basically, the employer comes and says, here's the offer for this year, and you can just kind of take it or leave it. And that's why our salaries have not even been keeping up with inflation, let alone the increased costs of tuition and the other expenses over the last 20 or 30 years. So I would certainly encourage you all to think about that and say, in our organizations, how could we band together and collectively negotiate with our employers for fair treatment and fair compensation? Okay, in the few minutes I've got left, legislative session, and that's what's mostly in that slide deck. It's also in the latest edition of the Utah Physician Magazine, where it really goes through bill by bill and talks about a lot of the things that went on in the legislature. And admittedly, we have successes and failures. We have things that we get and things that we didn't want. And I think one thing to emphasize is that the legislature is politics, and the body, the representation, the membership of the UMA is very heterogeneous. It is impossible for us to please everyone, and that's why we take our direction from that House of Delegates that represents the consensus. Also, we're in the state of Utah, and pragmatically, we have to work with the Republican legislature. And so sometimes success means we have a priority and we're able to get it passed. Sometimes success means we're able to block bad legislation, and we do get plenty of victories by preventing legislators with bad ideas from being able to implement their bad ideas. And then frequently, it's neither a success per se or a failure. It's making bad legislation better or good legislation great. I think to talk about legislature, two main bills or topics I think would have to be top of mind, both of which are quite controversial, and I don't necessarily want to go down that path per se, but I think that needs to be part of the discussion. And that would be abortion and the transgender care. So maybe just an update, and I think these last things are hopefully pertinent to what's going on in your practices and may impact your ability to care for your patients. We're aware that Roe versus Wade was struck down. It's been sent back to the states, and that Utah has a trigger law that was passed that's been blocked by the courts. The trigger law, of course, would prohibit all elective abortion. With that being blocked, the current law as implemented allows for elective abortion up to 18 weeks. If the trigger law were to go into effect, it would allow abortion up to 18 weeks for the health of the mother, a non-viable fetus, or rape or incest. Some other little subtleties there. There's a 72-hour waiting period, and if you're younger than 18, you have to have consent or permission from a judge. Additional legislation on abortion that just came out of this most recent session was House Bill 467. You may have heard of this bill that prohibited basically licensure of abortion clinics in the state of Utah. Functionally speaking, then does not allow abortion to be done in an outpatient clinic, forces it to be done in a hospital. There were some other subtleties to that bill, and this is one, by the way, where leadership in the House and the Senate had an agenda that they wanted to take place, and so we blocking it or making it pass or fail was really not on the table for us. So the best we could do was to partner and try to influence what came out. And so we were partners with the OBGYN Society in getting some additional language in this and softening some things. This bill also, by the way, is currently blocked from the court, so it's not been able to be implemented either, at least the portion to shut down the clinics. The biggest part of this bill that I think we would call a success is that we were able to get the language removed from the bill that made performing an abortion against the law a felony. Here again, working to remove the criminalization of the practice of medicine from our laws and statutes. So if someone knowingly were to perform abortion against the current laws of the state of Utah, it would now be considered unprofessional conduct as opposed to being a felony. The transgender bill is another instance where House and Senate leadership wanted this to take place, and so they reached out to Representative Ward and Senator Kennedy, both family medicine physicians, and basically said, you will run this bill. And then the real work was figuring out a way to make the bill as palatable as possible. And I don't envy these gentlemen and the task that they had trying to walk the line in a controversial subject. I think we should all be grateful that there are people willing to serve, and especially our physician colleagues who are willing to serve in the legislature. Senator Kennedy's home's been vandalized, and he's had threats made against him and his family for running this legislation. And regardless of what you think about it, I think we can all agree that that's unfortunate. The net effect of the transgender bill is to prohibit transgender treatments, or at least pause those treatments for minors, so anyone under the age of 18. It did allow for a transition period for those who are already undergoing that treatment, and then it also has language about who is able to provide that treatment, meaning there's essentially a certification that you have to obtain some proof of training if you're going to provide gender-affirming care for minors. I've only got a minute or two left. A couple of other kind of highlights. One that I want you to be aware of. There's an opioid prescribing bill. Be aware of this in your clinics. If you prescribe over 50 milliequivalents a day of initial prescription of an opioid, you need to prescribe naloxone with it, or at least offer naloxone. It also instructs that pharmacists need to counsel and offer and distribute naloxone for any in those same fall into that same category. The exception being if the prescription is a quantity that would be less than 3 days. So remember, greater than 50 milliequivalents in initial prescription, offer and prescribe naloxone. A couple other random successes. There was a magic mushroom bill you've probably heard. We were able to block that one. And then maybe just one that we didn't win, frankly. Representative Ward ran a bill about data and EMR interoperability. Basically, he'd like to force the 4 main systems in the state to sit down and figure out a way to make their data interoperable. His argument, and I share it, I'd pull my wand out again for that one, would be that patients be able to see any provider and the provider have access to their data, and when we see patients that we'd have that data at our fingertips. I suspect we have all been there in the emergency room or our clinic, and they're telling us about their MRIs and their studies and their consults, and we don't have any of it. We're all familiar with the compromise in our quality, the duplication of services, the cost and delay that it adds into our medical system. So with that, my time is up. I thank you for allowing me to take a tour down fantasy and reality lane. And I thank you for sticking it out, and I hope you all have a great weekend, and would love to chat with any of you afterwards if you'd like to talk. So thank you very much.